President-elect Donald Trump's choice of Robert F. Kennedy Jr. as head of the U.S. Health and Human Services Department is raising concerns due to Kennedy's skepticism of vaccines and other proven and accepted medical practices. Joining us now is former State Health Director Will Humble, now the Executive Director of the Arizona Public Health Association. Will, good to have you here. Thanks for joining us.
Thanks.
Thoughts on RFK Jr. as the possible, let's face it, the National Health Director?
Well, it's pretty alarming, honestly. It's one thing that he has a long track record of it's kind of a gadfly of believing things that don't have evidence associated with them, which is fine to be in the private sector, be a lawyer like that. But you put somebody in charge of the U.S. Department of Health and Human Services, which includes the Center for Disease Control, National Institutes of Health, the Food and Drug Administration, Centers for Medicare and Medicaid Services, which is how most people get their health care. You put a person who doesn't believe in the scientific method and doesn't use evidence to drive his decision-making in charge of those agencies. I mean, it's alarming, honestly.
Let's start with the kind of the highlight here, which has always been vaccines with him. That's his major topic, and that's what everyone's really concerned about right now, though there's a lot more, and we can get to that.
Right.
Just the skepticism alone can torpedo confidence, and that is an impact, is it not?
Well, of course, but it's not just skepticism. People keep saying, oh, he's a vaccine skeptic. No, he's anti-vaccine. He's actively against vaccines. He says he doesn't believe any vaccines are safe and effective. So, of course, it has an effect in the field of people deciding not to get vaccinated. But the alarming thing is that he would be in charge of the FDA, which licenses the vaccines, the National Institutes of Health, which provides funding for vaccine research, and the Centers for Medicare and Medicaid Services, which deliver the vaccines, and the CDC, which provides the recommendations. So you put somebody in charge of all those agencies who's actively anti-vaccine, give them all that authority, it could really devastate the public health system.
Let's talk about devastating the public health system, the impact on just measles, mumps, rubella, that vaccine being eased out of whatever situation it is, lessened. What happens?
Well, you have outbreaks. I mean,
but
measles,
what does it mean as far as outbreaks? Well, what kind of health? What are we talking about here?
Well, it causes like a high. Let's take measles as an example. Can cause really high fever. It puts kids, they get pneumonia. Some kids die. I mean, I was born in 1960. I had measles. My mom said I almost died, and the vaccine came along a couple of years later. So for people of my parents' generation, these vaccines were something of a godsend, you know. But over the years, I think people have become accustomed to, measles not circulating, which is a really dangerous disease. And now you've got, and we've come so far with a lot of different vaccines, not just measles. And to cut off research and to actively use the authority of these agencies to no longer provide those vaccines. He hasn't said that's what he's going to do, but if you have somebody in charge of an agency that doesn't believe in evidence like that, they can exercise that authority if they want to.
And again, a big concern would be polio. Again, that's the poster child of vaccines and how vaccinations can work. He says that vaccines and vaccinations cause autism. Is he wrong?
He's totally wrong. There have been so many studies that there was somebody who published something in Lancet many years ago that got this whole thing started. And there have been all kinds of studies and systematic reviews of those studies that all found that that's hogwash. And he still talks about it.
Why, and I don't expect you to know this, but why do so many people still believe that? I didn't expect you to answer that. You gave me a great response.
I'm a science guy. But I mean, there's people who get their, they believe things that are on like Instagram and stuff instead of legitimate research.
With the FDA aggressively maybe suppressing some products, promoting, I mean, he's an ivermectin guy. He's a raw milk guy. What does this mean to public health?
It all depends. What it means is it's dangerous in the sense that if you give a person like that all the authority that comes with that executive office, he can execute and use that authority to press ahead with those things that he believes that aren't associated with evidence. So that to me that's the fundamental problem, which is that you don't have to be a public health person to be a good health and human services director, but you do have to believe in the scientific method. You do have to believe in evidence. when you have a change of administration, there's always going to be a change in priorities for what they want to accomplish. But if you have somebody who fundamentally just does not believe in evidence, that's what's so disturbing to all of us.
Well, and again, the raw milk, I think, is interesting. There's a bird flu outbreak with dairy cow. It would seem like that would not make a heck of a lot of sense. He also, hyperbaric oxygen therapies. What is that? He promotes it. He thinks it works. He thinks it can cure autism.
I haven't read that. He believes in a lot of weird conspiracy things, like school shootings are caused by antidepressants. I mean, these are things that you just are like way out of left field, and yet being nominated to the most important health job in the country, if not the world.
Yeah, I shouldn't say cure autism. I should say treat autism. But be that as it may, his proponents say he's a disruptor. And that's not necessarily a bad thing when you think about health policies in this country. Are they wrong?
Well, certainly sometimes being disruptive can be good. So, for example, there is one thing that he wants to do that I agree with, which is that the Supplemental Nutrition Assistance Program used to be called food stamps. He wants to overhaul that so that it discourages people from buying unhealthy food products. He's not going to be in charge of USDA, which is the agency that implements that program. But that's a disruptive kind of initiative that could be good. But all of if you take the totality of what this person believes and you offer him a post that allows him to execute and use that authority for all these in harmful ways, it's I don't know what else to say. I already said it.
Yeah, you say, but last question here. What can be done within the health community, within the legal community, but mostly the health community where you sit? What can be done to fight back on this? I mean, is it basically information and that's it?
I think we're down to just talking to your senators. Senator Kelly about, through the confirmation process so that he doesn't get confirmed.
You think he's going to get confirmed?
I don't know.
Yeah.
I mean, it doesn't take 60 votes anymore to get, used to be 60 votes to get confirmed for these executive posts. Now it's 51.
Right.
And so what about some of these moderate, I just don't know what's going to happen with this thing.
And you're hearing the same thing from other health professionals around the country.
Oh, yeah. The American Public Health Association had a big statement today on this very thing.
And again, the last question I would ask you here is it possible that he has good ideas out there that could wind up coming to the fore and pushing some of these more outrageous ideas to the back?
I don't know.
You haven't heard anything so far that would suggest such a thing?
I don't know. He's such a wild card.
All right. I guess we'll stop it right there, Will.
Okay.
It's good to have you here. Thank you so much for joining us, and good information and concerning information, but thank you for joining.